Amy? Welcome, Amy.
Thank you.
Thank you for being here.
Good morning, ladies and gentlemen. My name is Amy James Risch. I've been in Idaho for since '05. I have autism and anxiety disorder. The reason I am here today is because lately my PSR services has been cut back. Now, throughout the 3 years in middle school I've been in, everything was stressful. In 6th grade, the school was difficult. I could barely manage. I didn't have services at the time. Well, good services, you know. I was being bullied a lot. Nothing was being provided for me. I was on the verge of insanity. I will not deny that. In 7th grade, I could not cooperate with others socially. I did not know how to socialize with others very well. The service was mediocre. There were aides there, but they were so focused on kids that couldn't walk, they couldn't talk, they couldn't feed themselves. They didn't get time to know me. At that time, I did have better PSR services, but the PSR worker was not allowed in my school to pick me up, so I could go to appointments. The school would have cut me off and wouldn't like me to have gone with her in the first place. It would have been great and amazing if she would have been able to go in and help me. Now that I'm in online school, I am doing way much better. But now since the services are being cut off, I am slightly fearing that she wouldn't be able to help me cooperate to be an independent adult. I want to be able to live my life, to work, to be much like an average American citizen. I want to live like any other person should be, with the same respect, dignity, and acceptance. I hope that the schools can allow PSR workers, trained ones might I add, into the school so that kids don't have that are having difficulties socially or maybe even academically can go to this person and seek help. It would help be very amazing. Thank you.
Thank you. Thanks for coming, Amy. Misty?
Mother, I appreciate you taking the time. Super proud of her, sorry. So I just wanted to mention as a mom, Optum, I'm very, how do we say, advocating for my child often. I used to get these quarterly reports from Health and Welfare, and it would say how many units were billed for case management and PSR. And being someone who wants to be a good steward of the services, and I would love to provide, but my full-time job couldn't afford the insurance. I used to get those that would tell me how many units, and then I could kind of keep track and help the system be, you know, transparent. With Optum, I haven't gotten any EOB. I'm curious to that. Her hours at first in October, sorry, I'm so nervous, were unlimited. It was just like, oh, we're unlimited, October and November. And then, no, I'm sorry, October only. And then November, they came back and told the PSR worker, sorry, she had 5 hours and cut her down to 5 hours a week. And then in December, they cut her down to 4. And now this month, they cut her down to 2. And the PSR worker can't get through on the phone. And she said, be prepared for Amy not to have services in February. That scares me. I'm sorry, because she's doing so well. We did have to pull her out of school. School was the primary issue. She would be so overstimulated and so stressed out and so upset that the PSR worker was pretty much just crisis managing her after school. Now, I worked full-time, single mom. I had an older child, and he would help, but the bottom line is school was kind of the trigger, and so I wish, as a parent, the PSR worker could have gone in, because the aides are $8 an hour and not a bachelor, not trained to deal with her. And the aides would almost trigger Amy. Like Amy, there were times where she was ostracized for testing. I mean, it was very blatant. And my point is just, I would like an EOB from Optum. I would like contact from Optum. Health and Welfare used to send me those forms. I haven't gotten anything. I didn't learn about Optum until I got a DD survey from my pool. So as a parent, I would just like more contact on a bilateral basis, I guess. Thank you.
Thank you, Misty. And Stacy Stevens? Welcome, Stacy.
Thank you. Good morning, Senator Hyder and fellow senators and representatives. My name is Stacy Stevens, and I have a little background music for us today. I don't mean to be dramatic, but this is what we listen to in my office for 4 to 7 hours a day. I don't know if you can hear it, but it's very, very hard to continue our daily work in order to provide the best services to our clients that we can. I don't want to beat a dead horse. I know you're working with Optum. I just encourage you to make sure that you put teeth behind the broken promises. They've also sat and talked to many of us and said, we promise we're not going to be like Molina. We promise we're going to do better. And we've experienced broken promise after broken promise. Please put teeth behind the promises they make to you. Thank you very much.
Thank you. We appreciate your testimony today. I'd like to hear from Paul Hymas, Doug Lurcher, Darcy Morono, Jim Baugh, and Bill Benkula. Is there anyone here that's driven a long distance that we haven't heard from? Okay, and I'll hear from you after this group of folks. Paul?
Thank you for the opportunity to be here. This is going to be probably some more repetition. My name is Paul Hymas. I am also from a mental health provider in East Idaho. We've had a growing concern for the future of behavioral health services in the state of Idaho. We've been in business providing services in Southeast Idaho for over 17 years, have been witness to the many changes that have occurred over the years. But what we've not seen is a functional collaboration between interested parties. Though there have been requirements for collaboration, there's not been a non-invested, non-interested third-party governor or mediator of the required collaboration. As a behavioral health provider, we have boots on the ground, so to speak. We have direct contact with the members that are receiving treatment. We understand their needs and their desires to improve their lives and situations. As a state, Idaho has had limited resources and services for its Medicaid behavioral health population. We understand there's a great need for changes in the processes and services provided. As a provider of the services, we would like to know that our input is valued and that we do have a say in the services we are providing. There are more cost-effective services than those that are currently being provided. There are also services that would have better results. Optum Idaho appears to understand that changes need to be made and that there needs to be more services added and some of our current services need to be altered. The concern for us as providers is the complete lack of communication and what changes are being made, what changes will be made, and how to prepare ourselves, our employees, and most importantly, our clients for these changes. Optum Idaho has not given providers clear guidelines or directions on how services should be rendered under their system, leaving providers as well as members confused and concerned. In order to increase our understanding of the changes in the ideal system that Optum Idaho, as well as the Department of Health and Welfare, would like to see in this state, we need clear guidelines and directions on what services to provide and how those services should be provided, as well as a unified collaboration of all involved parties that is governed or mediated by a non-interested third party. We are concerned that if we continue on our current path, we will continue to see the high suicide rates in Idaho. We will see the adverse effects not only on the mentally ill population, but also on the citizens of Idaho as a whole. As a citizen of Idaho, that concerns me. We are also going to continue to see a rise in inpatient hospitalizations and incarcerations, which cost Idaho taxpayers more money, which as a taxpayer also concerns me. Thank you for your time.
Thank you, Paul. We appreciate your testimony. Doug?
Mr. Chairman, members of the committee, I appreciate the opportunity to stand before you and testify and give you some input. My name is Doug Lurcher. I reside here in Boise. I own and operate two mental health agencies, one located physically in Boise, one located in Nampa. And you've heard the concerns for Optum and the excessive hold times, and what the problem really is that it's bottlenecking services. We're not able to provide services for the providers. Just as a small sample, in one of my agencies, prior to Optum, we were able to provide services from the time they contacted us to the time they're actually receiving the services. It was about 3 weeks to go through the process. Now it's currently around 6 weeks and continues to grow every week because the amount of calls that we have to make continue to grow. We can't keep up. Currently, we have about 50 individuals waiting for services to be approved in our agency because we get new referrals every week, and now the initial authorizations that happened at the start of the transition now are having to be reauthorized. And so you're adding more and more phone calls every week, and you've heard the example, you're on hold for 5 hours, and then when you get through, you can only talk to them about 3 at a time, then you have to recall back in. And so you can see if I get about 10 referrals a week and 10 more reauthorizations, you can't keep up. It won't happen in the current system. Rumor has it that they're making some changes, like adding a couple more care managers. In reality, they probably need to add more like 30 new care managers in order to keep up with the people across the state. The other rumor is that they are going to stop negotiations with providers when there's some discrepancy about if a provider thinks maybe 4 hours is appropriate and the care manager thinks 2 hours is appropriate. Right now, there's a conversation that takes place. The rumor is they won't have that conversation. It'll be referred to peer review, which is with the doctor. And currently, I think there's 2 doctors that do that. And so essentially, they're going to go from negotiating with 10 or 15 people, now we're negotiating with 2 people, and which is going to make the system even worse. The second thing I'd like to talk to you about is the definition of case management. And you've heard that arbitrarily, or not arbitrarily, but without communicating to the providers, they've changed the definition of case management to all face-to-face. That definition was not in their clinical care guideline. It only came out in their Q&A, their frequently asked questions section. That definition is not consistent with the definition that Medicaid currently reimburses for under their developmental population or the medical population. It's only mental health. So it's also not consistent with how Optum defines it in other states. The third thing I wanted to talk to you about today is that a week and a half ago I testified in front of the House Committee, and within 24 hours of my testimony, Optum was contacting my agency thinking something was amiss and wanted to clarify some things. And when I asked them what that was about, it was because of my testimony. They said that. And so I just ask you for protection, for when we come here as citizens and testify, that there's not a repercussion to us. Thank you for your time.
Okay. Thank you, Doug.